Welcome back to my channel. Today we'll be talking about flaviviruses, or the family of Flaviviridae. As we learned from the previous lecture on positive single-stranded RNA viruses, this is one of them. It has a genome of 10 to 12 kilobases, which is on the smaller side for single-stranded RNAs. So it has a fairly small genome. It is enveloped, and what is special about the flaviviruses is that they are often transmitted by mosquitoes. In particular, the mosquito is called Aedes aegypti. I like to think of it as Aedes aegypti because it's an important point to remember, because the places that this mosquito goes also indicate the places where this virus or flaviviruses are endemic. Today we're going to be focusing on four types of flaviviruses: the one that causes dengue fever, the one that causes Zika, and the one that causes yellow fever, and the one that causes Japanese encephalitis. As you can see, for dengue fever, it is commonly found in Southeast Asia and Sub-Saharan Africa. There are 4 serotypes which can be found together in one region. However, immunity to one does not mean immunity to the others, so you can get infected several times. And the serotypes are dengue 1, 2, 3, and 4. Who is at risk? Well, the travelers to these endemic areas. It is predicted that anywhere from 6 to 45% of people who travel to endemic regions can become infected. It is even more common than the flu, according to many scientific studies. What happens when you get dengue fever? Well, in approximately 1 to 10 infected individuals, they begin to develop symptoms such as macular rash, joint pain, hypovolemia. Additionally, their capillaries become extra leaky, which can lead to hemorrhages that appear as petechial rashes. They can also experience a decreased platelet count, which can be seen in thrombocytopenia. And this inability, or the decrease in platelets, can cause an inability for the blood to clot, and this is known as hemorrhagic fever. Overall, this can result in a short-term disability. However, this infection is only apparent, as we can see, in approximately 1 in 10 individuals. So how can we protect against dengue fever? Well, there are 2 vaccines available. There are more than 2, but we'll be focusing on 2 today. The first one is CYD15. It is 60% effective, and this efficacy varies between the different serotypes of dengue fever. It is least effective for serotype 2 and serotype negative individuals. To compensate for this, we have Takeda vaccine, TAK-003, which is a live attenuated quadrivalent vaccine that also has a varying efficacy, but is particularly effective for serotype 2 with 95.1, but not as effective for serotype 3. The difference between seropositive and seronegative individuals is not apparent, with 66.2% efficacy for seronegative individuals and 76.1% efficacy for serotype positive individuals. Now, moving on to the next flavivirus, we're going to be talking about the Japanese encephalitis virus. It is also found in Southeast Asia and also in Australia in the Torres Strait Islands, which is up at the top. Being in close proximity to birds and pigs places you at a high risk, because these animals, when infected with the Japanese encephalitis virus, are often asymptomatic. And then these can be transmitted in urban areas, particularly by the mosquito. What happens when you get it? Well, for every 500 infections, there's about 1 apparent infection which presents with symptoms such as headache, neurological defects that lead to seizures, speech problems, and also that they all come from the fact that the brain becomes inflamed. In other words, encephalitis. So it is clearly a very serious condition. You can even get something called thalamic hemorrhages, which is when the thalamus really swells and begins to bleed. Now, in 20 to 30% of the apparent infections, the individuals die, and in 70 to 80% they survive. Of those who survive, half develop a severe disability, including motor defects, language issues, but the other half may develop learning difficulties or behavioral problems which can be considered more mild. So what can we do? Again, get vaccinated. There are two types, Emojev and Jespec, that we're going to be focusing on. Emojev is a single-dose vaccine. It induces a rapid neutralizing antibody response with 20 years of immunity. However, for children, the immunity begins to wane a lot faster, so they may need 2 doses rather than just 1 compared to adults. The other vaccine is the Jespec vaccine, which are taken where there are 2 doses taken 2 weeks apart. They induce a 1 to 2 year immunity, and the booster dose is recommended after those years if you're traveling, and especially if you're the elderly, because these people may have a waning immune response. The third one, so yellow fever virus. It is again found in similar parts like Africa, South America. South America, this wasn't seen as much in the other viruses. It is also spread from mosquitoes. As we previously mentioned, what happens? Well, this is the annoying part. So it is called yellow fever because it causes liver failure, which causes bilirubin accumulation. That causes the eyes to appear yellow, etc. And also kidney failure. And now this is very confusing, especially for clinicians, because the clinical symptoms are often confused for things like leptospirosis. Now, the fatality is about 60%, but with support, that can get down to 5%. And by support, I mean medical support. What can we do? Again, get vaccinated, especially if you're traveling to those endemic areas. This is a single-dose vaccine with the live attenuated virus. However, there is a bit of a risk, which is rare. However, this risk is mostly seen in people who are under 9 months old. They develop something called neurotropic disease, and this happens 1 in 8 million. And for people over the age of 75, they are at risk of developing something called viscerotropic disease when they get the vaccine. And this is also a very rare event. So the general recommendation for couples who are taking their children out is to wait until they're at least 12 months old so they can get vaccinated and then go to these endemic areas. Yep. Okay, now moving on to the Zika virus. Compared to the other viruses, Zika virus has a higher apparent infection rate, about 1 in 5. However, it is not as fatal. It is also found in similar parts of the world, such as Southeast Asia, South America, and Central Africa. But even though it is not as fatal, it's important to get vaccinated against this, especially for women who are planning to get pregnant, etc. Because when this spreads to the baby, this can cause many developmental problems such as microencephaly, and you should also get vaccinated so you can't spread it to other pregnant women. The incubation period is fairly short compared to the other viruses, taking less than a week. And it can be sexually transmitted as well as congenitally transmitted. So again, it's important to take the vaccinations. In terms of diagnosis of flaviviruses, you would have a mix. You would need clinical symptoms, which we have mentioned before, as well as laboratory testing. However, serological tests such as ELISA against anti-flavivirus IgG and IgM is not specific enough, because in people who are vaccinated, they can still show up as they can still present with a titer of IgM and IgG, but then you can double check that using PCR antigen reactions as well. Okay, so that's it, and that's all we know about flaviviruses so far. If you have anything you would like to share, please leave it down in the comments below. Thanks!